Morning, Danny.
Good morning.
All right, we'll get the official Steve Jobs timepiece here. All right, it's 9:19, Wednesday, March 18th. We'll call this special meeting of the Marion County Board of Supervisors to order. Roll call.
Keisha Johnner,
Here.
Mark Ramey,
Here.
Steve McCombs.
Here.
Really have no agenda, Danny, for this morning other than continual updates, so we can have a motion to approve that, I suppose.
Make motion to approve continual updates.
Second.
McCombs,
Aye.
Ramey,
Aye.
Johnner.
Aye.
Very good. So we are in open session right now. If there's a need to move into closed, Danny, I'll let you know.
Okay.
Right now, are there any updates from an open session standpoint that we can provide, especially since we have media here? We want to make sure that we get the right information out to as many people as we can through as many vehicles as we can. Counselor.
I would indicate that Chief Justice Christensen of the Iowa Supreme Court yesterday, or last evening, excuse me, signed an order providing guidance to the courts on how to move forward during this time. And ultimately, the message, I think, to the public may or have the potential to be confusing. And so there's a couple things that need to be abundantly clear. The first is that the clerk of courts will remain open at this time.
Okay.
If individuals need clerk of court services, which majority may include things such as mental health or substance abuse commitments, or protection from domestic abuse or sexual abuse, which are traditionally pro se things that are done, those will still continue to take place.
Okay.
However, in addition, my office's commitment to continue to work with people who are trying to get their driver's license back will continue, okay? If you have a court date, though, that you think you have coming up, you should contact your attorney because 99.9% of those court dates are going to be continued until a date after May 2nd.
Okay.
We are working through that to try to reschedule more than 1,000 court hearings over the next 12 hours. It's an incredible effort to reschedule and then put it on a date that will work for folks. So later today, I will be sending through Joint Information Command a couple documents. The first will be a list of the most common defense attorneys' names and phone numbers, so that people in the community who have court, who have an attorney that may not remember their attorney's phone number, they can gain access to talk to them. Because unfortunately, them calling our office because they're represented by counsel, it's problematic with my office contacting them, because even if it's just to find out their date, which is a permissible ex parte type communication, sometimes it can lend itself to spillover. We don't want to put ourselves in that position.
No, that's very wise.
So things are secondly, we have gotten a lot of guidance in the last 12 hours from the Attorney General's office on enforcement of the governor's proclamation. It has come in 60-page, easy to read. I don't know if we're calling him Acting Sheriff Kingery, but Justin and I will make our way through these documents today.
Okay.
The other thing
Can I stop you there
Yes.
for a second? That was probably my number one question, because those were the genesis of most of my calls this morning, is how do we interpret what the governor produced yesterday? So I'm glad to hear that you two will go through that. The more you can synthesize that down into a concise bullet point document on how we will do these things, I think the more helpful it will be to the community at large.
And we will attempt to get that done today.
Okay, very good.
I'm also trying to oversee the continuance of probably 1,500 court hearings, so getting everything changed.
Understand.
From a standpoint of the public, though, I also want to make sure that our juvenile court proceedings that involve child in need of assistance actions, removal hearings, those type of things that are for the protection of children are still going to take place.
Okay.
So I want the public to understand if they still suspect child abuse is going on, they should still call the DHS helpline. Those folks are going out and still protecting our kids.
Okay, very good. Thank you, Counselor, for that update. Justin, any updates for the public from a law enforcement perspective?
Not from law enforcement, but so our civil office has already received several calls in reference to gun permits and how we're gonna do that. So I asked Jenny to produce a document, email it to me that I can get to the JIC, an online website where they can print off the form. They can then send that form along with their payment, which will have to be money order. I don't want them to send cash, and we don't take checks. So money order in the mail. And Jenny also emailed the guy who's kind of in charge of the gun permit process, and because some of the questions they can renew it. It's kind of like a license, 30 days before, 30 days after. It's $25, but if they're late, it's $50. So if they were going to waive that fee, it's kind of similar to what they did for a vehicle license and that sort of thing. So she's getting an answer, and then sometime today, I asked her to try to get it before 11 so I could get it for the first update.
Okay.
So that will be on the JIC as soon as I have that information.
Okay, very good. Thank you, Lieutenant Kingery, and great work out there at the Law Enforcement Center. Emily, you're the only media person in here. Do you know about our Joint Information Center? Are you aware of it?
Yep.
Okay, you
Yep.
have the links to
Yes.
it and everything, and the update schedule. Kim, what is our update schedule?
It's at 11 o'clock and 4 o'clock daily.
Our goal as a government body is to make sure from a media standpoint and also for our residents, to have that be the repository for all relevant communications related to this crisis. That cuts down on those one-off phone calls that we're all getting, asking for opinions, asking for information. We will digest, as County Attorney Bull just said, we're getting guidance from a variety of sources. It will take us time, and we will do so in an expeditious way to try to turn those around and understand how it impacts both our residents and how we operate as city and county entities. But it's going to take us a little bit of time to get that information and then put that into an operational format. So be sure to check that on an update basis. We are also scheduled to have a press conference at 1 o'clock today. That's what the podium is for. I believe Knoxville will be here, and Jeff will have more of an update on that. I've asked him to coordinate that. I did speak with Mike Nardini last night, City Administrator Pella, and they said they would like to be in attendance for that. The goal of that press conference will be essentially to provide updated information similar to what we're doing now on county actions to date, and make sure the public is aware of the things that we are doing. Also to just be a reminder on the changes in operations. We want to make sure the public is aware of what is our policy right now as the situation continues to be very fluid, and we are making adjustments really in real time. So that will happen at 1 o'clock today. It will be our first attempt at doing a live media broadcast, so bear with us on some of the logistical issues that come with that. Kim, any updates from a public health standpoint that we can do in open session?
We need to make sure that people understand that just because somebody says that they're a confirmed case doesn't necessarily mean that they're a confirmed case, because there's been lots of situations across the state, and it's really blown up this morning where
I know that's been some of the phone
somebody
calls.
says,
Yeah.
hey, I went to the doctor says I have it.
So let's be clear.
So
I sound like Bernie Sanders, and that just scares me. So we have no confirmed cases in Marion County.
I am not aware of any confirmed cases in Marion County.
All right, so let's be very clear. And as that situation changes, we will certainly make our public aware. and react and respond appropriately.
And people need to keep in mind that there are other things circulating in the population, like regular coronavirus, which is a cold.
So do me a favor, and for for Emily's sake, as the media, define community spread.
Okay, community spread happens which we are in community spread in Iowa now. So before we have community spread, we're able to link every case of COVID-19 to another case or to an area of the world that has, they can epi-link it, they can connect, this person got it from there, from that place. And so now it's community spread across Iowa. So there is, they don't know where people are getting it from. The person who was tested and it came back positive hasn't had any contact with a person that they know of that has it, and they have not traveled. So that means that they got it somewhere in the community. And so there is no actual link to a known case.
This is, yeah, thank you, Kim.
That's a really big deal, and it changes how we will be approaching things going forward.
Yes.
Kind of coattailing on what you said, excuse me.
No, go ahead.
Coattailing on what you said, Kim, if you were to go to a local facility, hospital, i.e. hospital, to get tested, from how those tests are, how long does it take to confirm? And they don't just look at you and say you got it. They have to do some type of blood test.
In order to be tested, you have to be swabbed. And so what's happening across Iowa is that people are going in and doctors are testing for flu and ruling out flu and saying, oh, it must be this. But it's not something you can do by a rule out methodology.
That goes back to the conversation you and I had yesterday, that the COVID-19 is a variation of the coronavirus.
Correct. There are 7 coronaviruses. This is one of those 7.
Okay, so just because it tests positive for coronavirus, it's not the COVID-19.
Well, there's different tests
Okay.
for each
There's
one.
different tests
So-
for each
I just wanted to
yeah,
be clear on what.
But there is a specific test for COVID-19, and there is still criteria in place to send those to the Iowa's lab,
Maybe our
to
doctor should be
UHL or
using.
SHL.
Well,
But your doctor can do this through a private lab, but to get those results back, it's gonna be 4 or 5 days.
Okay,
Yeah,
maybe they should be using a
So-
different terminology.
The
when
biggest
they-
thing though is, Kim, is we have no confirmed cases in Marion County at this
Correct.
point.
Correct.
And if we do have confirmed cases, you will let us know.
Yes, when we have lab confirmed cases, it will be announced that there are lab confirmed cases in
So the
Marion
media
County.
could
We
put
will not
something
say who
out
they are.
sooner than later. And it would be, because I know that there's some hype out there, but there is no confirmed cases in Marion County.
Correct.
that
And
is
I would be beneficial.
that is the essential message. There are no confirmed cases.
Thank you, Kim.
And in addition, that also heightens everything we've done from when we've talked about the measures that we are taking in accordance with the president's 15 days to control the spread. That's why that becomes paramount. This is a fluid situation. There will be changes in processes. There will be changes in procedures across our entire platform of dealing with the coronavirus. That will be at a national level, that will be at a state level, and it certainly will be at a local level. But when we talk at a county level about flattening the curve and being partners in that, that's our job. That is our job and our responsibility, both as government officials, government employees, and our public. So that's the message ultimately, Emily, we want to get out to folks, that responsibility to help control the spread is job one. Everything else is speculation. Everything else is trying to play in an area that we don't really have a lot of information on. We leave that to the medical professionals. We leave that to the state and federal authorities to provide us with that guidance as they get it. Okay, good. Anything else from an open meeting standpoint that we need to address right now while Emily is here? I can't think of anything. Supervisors, is there a necessity to move into closed session?
I do.
Counselor? Counselor says that there is.
Okay.
All right, so I will entertain a motion to move to close open session.
I move we close open session.
Second?
Danny?
Ramey,
Aye?
Johnner,
Aye.
McCombs,
Aye.
Very good. Thank you, Emily. Entertain a motion to come back into open session.
Make motion to come into open session.
Second.
Jeffrey,
Was
open the
she,
door.
I'll open the door.
Johnner,
Aye.
Was
McCombs,
Aye.
She wasn't.
Ramey,
Aye.
Let me see if there's anybody out there. Oh. We just have mental health is here.
Okay, very good. All right, thank you. All right, it is 10:25. We're back in open session. The results of our closed session discussion. Board of Supervisors met with various county departments to continue to discuss county response to the COVID-19 crisis. There will be future updates on this in subsequent Board of Supervisor meetings. With that, I would entertain a motion to adjourn.
Make motion to adjourn.
Second.
sorry, McCombs,
Aye.
Ramey,
Aye.
Johnner.
Aye.
We are adjourned. Thank you, Danny.
Thank you.